In this video, I'm going to walk you through the different types of test questions used in NCLEX examination and the secret strategies for answering them step by step, and be sure to watch the entire video. My name is Philip Pador, founder of NCLEX-RN 45-Day Challenge, where we give you the tips and the resources that you need to totally pass your NCLEX in 45 days and become the best nurse that you can be. The test questions used on the NCLEX-RN exam are written to test the knowledge, skills, and abilities essential to provide safe client care. Understanding the types of questions, the cognitive level of the questions, as well as the thinking processes used to answer the questions is essential for tests to success. This video provides information about the test items used on the NCLEX-RN exam and offers secret and strategies for answering questions for various types of test items and levels of the cognitive domain. So the NCLEX-RN examination uses 8 types or formats of test items. This includes multiple choice items and 7 alternate item formats like multiple response, fill in the blank or calculations, hotspot, chart or exhibit, drag and drop ordered response, graphic options, and audio items. Questions can also be written using video clips as prompts for questions. Although these questions are not currently being used by the National Councils of State Boards of Nursing, although each type of item tests your understanding of nursing content and is developed using the same test development process. Each type of test item requires you to respond in a different way because alternate items formats test knowledge, skills, and abilities in a variety of ways. There are increased opportunities for you to demonstrate your competence. All test items are scored either correct or incorrect. No partial credit is awarded for any question type. The first type of question is multiple choice. This item includes scenario or situation, a question, and 4 answers, only one of which is correct. The scenario provides information about the client or care management situation. The question poses the problem to solve. The question may be written as a direct question such as, "What should the nurse do first?" Or as an incomplete sentence such as, "The nurse should." The answer or options are possible responses to the stem. Each stem has correct options and 3 incorrect options. The options may be written as a complete sentences or may complete the sentence stem stated in the question. Multiple choice items are the most common types of test items used in licensing exam. Let's look at the question example. So which information would the nurse include in the teaching plan for a 32-year-old female client requesting information about using a diaphragm for family planning? 1. Douching with an acidic solution after intercourse is recommended. 2. Diaphragm should not be used if the client develops acute cervicitis. 3. The diaphragm should be washed in a weak solution of bleach and water. And number 4, the diaphragm should be left in place for 2 hours after intercourse. Secrets and strategies for answering multiple choice questions are: read the scenario and relate the questions and answers to the data provided in the scenario. Pay particular attention to information, if included, about the client's age, family status, health status, ethnicity, place of care, or point in the care plan. Answer the questions before looking at the possible answers and choose the answer that best matches the answer you first thought was correct. Recognize that only one answer is correct. Double check your answer to be sure you have responded to the question. Note particularly keywords such as first, except, not, most, and last. Be sure that you are basing your answer on best nursing practice, not experience with one client in particular clinical agency. Multiple response items. Multiple response items are similar to the multiple choice items, except that they include 4 to 6 answers and have 2 or more correct answers, and the others will be incorrect. There will be not an instance in which the answers are either all correct or all incorrect. These questions will ask you to identify all of the answers that are correct or select all that applies. Multiple response questions will be scored as being either correct or incorrect. No partial credit is given for selecting some of the correct responses. A preemie-gravid client is completed her first prenatal visit and blood work. Her laboratory test for the hepatitis B surface antigen is positive. The nurse can advise the client that the plan of care for this newborn will include which of the following interventions. Select all that applies. Number 1, hepatitis B immune globulin at birth. Number 2 is series of 3 hepatitis V vaccinations per recommended. Number 3, hepatitis B screening when born. Number 4, isolation of infant during hospitalizations. Number 5, universal precautions for mother and infant. And number 6, contraindications for breastfeeding. When using the text pages in this book to answer the multiple response questions, you can make check marks in the boxes located in front of the answers. When taking the actual NCLEX-RN exam, you will place your cursor on the box in front of the answers you wish to select, and click on the box. A check mark will appear indicating that you wish to select that answer. To change an answer, you can use the mouse to remove the check mark from that box. Hotspot items. Hotspot items involve identifying the location of a specific item, such as an appropriate injection site, assessment area, or correct part of the waveform. The question will be phrased, identify the location, or select the area. In the sample hotspot item, the nurse is preparing the client diagnosed with pleural effusion. For a left-sided thoracentesis, the X-ray shows fluid in the pleural cavity. During the preparation for the procedure, the client asks where the healthcare provider will put the needle. Select the appropriate site from the diagram below. When answering hotspot questions in the book, you should place an X on the illustration provided. A red X will appear over the area you have selected. If you make an error, you move the cursor to the part of the figure that is the answer you wish to enter. Secrets for answering the hotspot questions. Number 1 is read the questions carefully and answer the questions first by visualizing the answer. Then look at the figure to mark your answer. Double check your answer to make sure you have selected the correct spot based on evidence for best nursing practice. Fill in the blank items or calculations. Fill in the blank items involve calculations such as determining a drug dose, calculating an IV drip rate, or totaling intake-output records. These items can be answered with a number. On the NCLEX-RN exam, if you do not enter a number, you will receive an error message that will prompt you to enter a numeric answer. When an answer includes measurement such as milliliters, grams, or inches, the measurement unit will be stated in the stem of the questions and supplied in the answer box. Thus, you will not include the unit of measurement as a part of your answer. The questions will indicate if you are to round your answers and if so, to how many decimal places. Let's see the sample fill in the blank items. A laboring client with preeclampsia is prescribed magnesium sulfate 2 grams per hour IV piggyback. The pharmacy sends the IV to the unit labeled magnesium sulfate 20 grams per 500 ml normal saline. To deliver the correct dose, the nurse should set the pump to deliver how many milliliters per hour. Record your answer using 1 decimal place. When answering the fill-in-the-blank questions on the text pages of this book, you can use paper and pencil, and a handheld device with a calculator or a calculator to determine your answer. However, on the actual NCLEX-RN exam, a drop-down calculator will be available for you to use to calculate your answers. The division signs use similar to the use of the Microsoft calculator. Be sure to familiarize yourself with the mathematical function of the keys. To practice the calculations required to fill in the blank questions, use the calculator on your computer. The secrets for answering fill-in-the-blank questions. Number 1 is determine what calculation the question is asking you to perform. It's either add, subtract, or use the formula. Write the calculations on the erasable right board provided to the testing center. Access the drop-down calculator from the computer to perform the appropriate mathematical questions and function. To avoid calculation errors, be sure that you do not enter the numbers rapidly when you are using the calculator. Round the numbers as directed to 1 or 2 decimal points. Round the number after completing the calculations. If rounded numbers are required to answer the questions, the decimal point must be included in the answer. Place your answer on the appropriate line. Double-check your answer using a logistic test. Is the answer plausible? Did I perform the correct mathematical questions? Is the answer appropriate for the unit of measurement required in the questions? Chart or exhibit items. Chart or exhibit items present data from a chart, graph, or a table. Data from a client's chart will be presented from one or more chart tabs such as prescriptions, history and physical, laboratory results, miscellaneous reports, imaging results, flow sheets, intake and output, medication administration record, progress notes, and vital signs. On the actual NCLEX-RN exam, you will be prompted to click on the exhibit button below or additional client information. You will then use the data presented in the scenario and on the chart or exhibit to make a nursing decision. For example, you will click on up to 3 tabs to locate data, and then you will interpret the data. Validate if the data are correct or sufficient, and then be asked to respond to questions based on the data. In this book, chart exhibit questions show data on 1 or 2 tabs and then ask you to use the data to respond to the questions. When these types of questions are administered by the computer, you may be asked to determine which tab to use to locate the information that is required to answer the questions. You will click on the tab to open the tab, and pop-up window will appear on the computer screen. Let's see the sample chart exhibit items. The nurse is reviewing the history of physical and healthcare provider prescriptions on the chart of a newly admitted client. The nurse should first, 1. Initiate airborne precaution. Number 2, apply oxygen at 2 liters per nasal cannula. Number 3, collect a sputum sample. And number 4, reassess vital signs. So the secrets for answering chart or exhibit questions are: read the scenario and questions carefully to understand the context for the data to be provided in the chart or exhibit. For example, are you looking for a vital signs? Would an elevated pulse or drop in blood pressure be consistent with the context of the questions and provide data for making a nursing decision? Read the information provided on the chart or exhibit and identify the information that is essential to the answer and the questions. Double-check your answer by being sure you have obtained all of the data necessary to answer the questions and that the answer is complete and plausible. Drag and drop order response item. Drag and drop order response items require you to place information in a specified. For example, the questions might ask you to put steps of a procedure in order, or provide information about several clients and ask you to determine the order of the priority in which each client should receive nursing care. Or the questions may ask you the order in which to teach a client about a procedure or a self-care process. There may be up to 6 options to arrange in a specific order. The questions will be scored as correct or incorrect. There is no partial credit for having part of the answer in the correct order. Sample drag and drop ordered response item. The nurse's assignment consists of 4 clients. Prioritize in order from highest to lowest priority. In what order the nurse would assess these clients after receiving report. Number 1. An 85-year-old client with bacterial pneumonia, temperature of 102.2 degrees Fahrenheit, and shortness of breath. Number 2. A 60-year-old client with chest tubes who is 2 days post-operative following a thoracotomy for lung cancer and is requesting something for pain. Number 3. A 35-year-old client with suspected tuberculosis who has a cough. And number 4. A 56-year-old client with emphysema who has a scheduled dose of bronchodilator due to be administered with no report of acute respiratory distress. When answering drag and drop ordered response items in this textbook, you will write the appropriate step number next to the answer choice. For example, write the number next to the first step in the process. 2. For the second step in the process, and also until all the answer choices have been used. On the actual licensing exam, you will drag each response from left-hand column and drop it into the correct order to the right-hand column. You can move the items around until you have the item in the correct order and then click Submit to enter your answer. If you need to change your answer, you can drag the response to another position and reorder the responses. Secrets for answering drag and drop ordered response questions. Read the questions word in the stem of the questions that indicate the order in which you are placed to answer. Test the logic of your answer. Be sure all items have been placed. Double check your answer by reviewing the correct order for the answers and that you have placed your answers in the order in which you intend to answer the question. One answer out of order will cause the question to be counted as incorrect. Graphic option item. Although graphics can be used as a part of the questions, with graphic option items, the answers to these questions are presented as a graphic. Graphic option items use graphic figures, illustrations, photos in the answer to the questions. You will need to select the correct answer from the graphic options offered as possible answer to the question. In the text of this book, you can use your pencil to mark your correct answer to graphic option question. Item which is the correct, not used to secure a restraint correctly to a bed frame. Secrets for answering graphic option questions. Read the questions carefully and visualize the answer before looking at the options presented with the test item. Look carefully at each graphic options and be certain you understand the difference among the options. Select the options that best answers the question. Double check your answers by reviewing the questions, answering the questions based on the nursing practice, and match the answers to the graphic option. Audio item. Audio item includes a short audio clip with data that are essential to answer the question. For an example of how a question is written. For example, you could be asked to listen to breath sounds, heart sounds, bowel sounds, or verbal interactions. The questions will indicate that you should click on the play button to listen to the audio clip. You will be able to play the audio clips as many times as needed to answer the question. The questions may ask you to identify the sound on the audio clip. For example, type of breath sounds or you may ask to make a nursing judgment and or select nursing actions based on the interpretations of the sound. You will be able to listen to the sounds and choose the correct answer. When taking audio test questions on the actual NCLEX-RN exam, you will have headsets to use and you will be able to adjust the volume. Secrets for answering audio questions. Read the test items carefully to understand the clinical context in which the scenario occurs. Listen to the audio clip before answering the questions. Listen to the audio clips as many times as needed to answer the questions. Relate the sound in the audio clip to the scenario in the best item. If the question asks you to make a nursing decision or select a nursing action based on your answer on your interpretations of the sound and the best nursing practice. Double check your answer by reviewing the questions and answering the questions based on the best nursing practice. Video items. Video items use video clips to present a clinical situation or demonstrate a procedure. The questions will be based on information you have viewed on the video clip. Although the video items currently are not used on the licensing exam, we have included several examples on the point. Secrets for answering video items. Read the questions carefully to understand the client or the clinical context of the questions. Anticipate what the video clip will show, what you should pay particular attention to when you are watching the clip, and how the questions relates to what is being shown in the video. Play the video clip as often as you need to view the actions. Look for actions that are correct or not correct. Double check your answers by comparing the video clip and the answers options and selecting the options that presents the best nursing practice.